currently in the med room about to perform my first medication check of dispensing the medication, only preparing one client at a time. I have previously performed my dosage calculations for my medications as well as referencing my drug book to make sure I know all the proper functions of my medications. So to begin, I'm going to wash my hands, apply gloves, so for my first medication, I have diazepam. So I'm going to ensure that I have the right client, medication, dose, route, time, and look for any expiration dates, as well as comparing it with the MAR. My second medication, I have my ceftazidime. I'm going to ensure it has the right client, medication, dose, route, time, and ensure that it is not expired, and I'm comparing that with the MAR. And for my third medications, I have my regular and NPH insulin. Going to ensure that I have the right client, medication, dose, route, time, and look at any expiration dates. For my fourth medication, I have my purified protein derivative, making sure I have the right client, medication, dose, route, and time, and making sure it is not expired. And for my last medication, I have escitalopram, making sure I have the right client, medication, dose, route, time, and making sure it is not expired. So now that I am done with my first medication check, I'm going to remove my gloves, wash my hands, put on a new set of gloves. Now I'm going to perform my second medication check, going to prepare my medications. So for my first medication, I have diazepam. So I'm going to need, so I'm going to break my ampule, making sure that I have the right client, medication, dose, route, time, and looking for any expiration dates. None of that is apparent, so I'm going to break my ampule, ensuring away from the client and away from me. I'm going to dispose. I'm going to take my 3 milliliter syringe and my filter needle. So I'm going to need 1 milliliter of my diazepam. I'm going to draw up 1 milliliter. A little over 1 milliliter. I'm going to place this in the sharps container. 1 scoop method. Actually, I'm going to take it to the sink, ensure that there are no air bubbles, eliminate excess medication. Making sure I have 1 milliliter of medication. 1 milliliter. I'm going to do the 1 scoop method. Remove my filter needle and place on a 25 gauge and 1.5 inch needle. I'm going to label my syringe and put it to the side. Now going to remove my gloves, dispose of them, wash my hands, put on a new pair of gloves. Now for my second medication, I have ceftazidime. I am going to take my Constitution powder and my sterile water, ensuring that I have the right client, medication, dose, route, time, and making sure it is not expired. Going to remove my caps. Clean off cap lids for 20 seconds. Going to do the same thing to the other one. And while I'm comparing all my medications, I'm comparing them to the MAR. Okay. Now, since I need 1.2 milliliters of medication, I'm going to put a needle on my syringe. My reconstitution medication insists that I put 2.5 milliliters of diluent into my powder for intramuscular use. So I'm going to draw up 2.5 milliliters of air. Going to inject the air into my vial. I'm going to draw up 2.5 milliliters of sterile water. A little bit more than 2.5. Going to come to the sink, eliminate any air bubbles. Ensure that I have 2.5 milliliters of sterile water. So 2.5 milliliters of sterile water. So I'm going to inject my water into my medication. One hand scoop my needle. Dispose. I am going to get a new needle, 25 gauge, 1.5 inch. Place it on my syringe. Going to mix my medication by rolling. I'm going to clean off my vial one more time for 20 seconds. Now I'm going to need 1.2 milliliters of my medication. So I'm going to draw up 1.2 milliliters of air. Going to inject that into my medication. I'm going to draw up 1.2 milliliters of my medication. Well, a little bit more. I'm going to take it to the sink. Remove any air bubbles. Eliminate excess medication. Now I have 1.2 milliliters of my medication. So I'm going to recap my medication, label it, put it to the side. I'm going to remove my gloves, wash my hands, put on a new set of gloves. So for my third medication, I have my regular insulin and my NPH insulin. So I am going to clean. Well, before I clean, I'm going to compare, make sure I have the right client, medication, dose, route, time, and check for an expiration date. I'm going to clean my vials for 20 seconds. I'm going to clean my other vial. Okay. I'm going to take my 100 unit insulin syringe. Now I am going to, I need 35 units of insulin, so I am going to draw up 30 units of air and place that into my regular insulin. I apologize, I'm going to restart. 1 scoop method to restart. So I'm going to need 35 units of insulin. So I'm going to take 5 units of my NPH insulin. Remove it. I'm going to put 30 units into my regular insulin. Going to recap. I'm going to mix up my NPH insulin. I would have done this before. And so now I'm going to draw up 30 units of my regular insulin. going to draw up 5 units of my NPH insulin. I'm going to ensure that I have 35 units of insulin. I'm going to 1 scoop recap my needle. Going to label it and put it to the side. So now I'm going to remove my gloves, wash my hands, and put on new gloves. So for my next medication, I have my purified protein derivative. So I'm going to ensure that I have the right client, medication, dose, route, time, and look for any expiration dates. Going to remove cap, clean the tops for 20 seconds. Going to take my 1 milliliter syringe, and I am going to need 0.1 milliliters of my medication. So I'm going to draw up 0.1 milliliters of air. And into my medication, inject, and then draw up 0.1 milliliters of medication. Go a little bit over. I'm going to go to the sink, get rid of any air bubbles. Get rid of any excess medication. I have 0.1 milliliters of medication. I'm going to re-scoop, label my syringe, put it to the side, remove my gloves, trash can, wash my hands, put on a new set of gloves. So for my last medication, I have escitalopram. I am going to make sure I have the right client, medication, dose, route, time, and make sure there's no expiration date. Make sure it is within the expiration date. So I need 10 milligrams of my medication, and we have a 20 milligram tablet. So I am going to clean my pill cutter, and I have verified that this medication can be split in half. Going to let that dry a second. Okay, so now I'm going to take my medication, place it in the pill cutter. Ensure that I am going to cut it on the score. So I have my 10 milligrams of escitalopram. Going to put it to the side. And we're going to put this medication to the side. Going to clean the pill cutter. Put it to the side. I am going to remove my gloves, wash my hands. I will have put all my medications in the appropriate receptacle, ensuring that I have another nurse with me to ensure that I am disposing them correctly. So now I'm going to get ready to go to my patient's room. Okay, I have all the equipment that I need. I performed my first and second medication checks. I'm going to enter my patient's room. Hello, my name's Alexia. I'm going to be your nurse today. I'm just going to shut the door for privacy. Wash my hands. Can you verify your name and date of birth for me? Okay, I'm just going to ensure that you are the correct patient with the wristband and compare it to the MAR. Okay, good. So today I'm going to be administering just a few medications according to your chart. Do you have any pain today? No pain? Do you have any allergies? No allergies, okay. Is it okay if I take your vitals consisting of blood pressure, heart rate, temperature, respirations, oxygens, as well as blood sugar, just to ensure that I have baseline vitals for my medications? Okay, I have taken all my vitals. I will document them, and I am ready to begin. So, for the first medication, we have diazepam. This is for your anxiety. You will want to inject this medication slowly. It may cause a little bit of drowsiness, dizziness, and constipation. So if you're experiencing any of that, please let me know and we can assist you off and on the bed or where you need to go. But if you do experience slurred speech, slow breathing, or slow heart rate, please report that. So I'm going to wash my hands, put on gloves. I am going to inspect my injection site for an intramuscular medication, which is going to be my patient's deltoid. So is it okay if I look at your deltoid? Okay, so let me lower the bed rail. So my patient's deltoid, 2 fingers down from the acromion process and 1 hand up, and it'd be right here. I'm looking for any lumps, lesions, wounds, inflammation, scars. None of that is apparent. So I'm going to take an alcohol pad, clean my patient's skin inward to outward, 20 seconds. Okay, so while I let that dry, I'm going to do my third medication check consisting of the right client, medication, dose, route, time, and ensuring there are any expiration dates Yeah. Okay. So now that the skin is dry, I am going to remove my needle cap. I'm going to pull the skin taut. I'm going to hold my syringe at a 90-degree angle, and with a dart-like motion, going to inject slowly. Hold for 10 seconds. Remove the same way I came out at a 90-degree angle. One scoop method. Place into the sharps container. I'm going to take a cotton ball and wipe up any minimal bleeding. I'm going to remove my gloves. Wash my hands. I'm going to inspect the injection site after administration, looking for any lumps, lesions, wounds, inflammation, redness. None of that is apparent. So I'm going to move on to my second medication, consisting of my ceftazidime. This medication is an antibiotic, and you will want to also inject this medication slowly. So you might experience a little bit of pain, swelling, or minimal redness after the injection. But if you do experience any anaphylaxis or it's hard to breathe, you do need to report that. So I'm going to wash my hands. I will have documented that I gave my medication. So today is the 8th time. Okay, so now I will have put on my gloves. I'm going to assess my injection site, which is going to be the vastus lateralis for another intramuscular medication. So I'm going to expose my patient's leg. So this one's going to be the upper outer portion of the leg. So it's going to be one hand above the knee as well as one hand below the trochanter. So it'll be right here. I'm also looking for any lumps, lesions, redness, swelling, or scars. None of that is apparent. So I'm going to clean my injection site for 20 seconds. And while that dries, I'm going to perform my third medication check, consisting of the right client, medication, dose, route, time, and looking for any expiration dates. None of that is apparent, so I am going to remove my needle cap. I'm going to pull the skin taut. I'm going to inject my needle at a 90-degree angle as well as with a dart-like motion. I'm going to inject slowly. Hold for 10 seconds. Remove at the same angle I went in. Going to recap my needle. Dispose. I'm going to wipe up any minimal bleeding. I'm going to remove my gloves. going to keep one because we ran out of gloves. Oh, here. I would have removed my gloves, washed my hands, and assessed the injection site for any lumps, lesions, or redness or swelling. None of that is apparent. So I'm going to move on to my next medication after I document that I have given it. So for my next medication, I have my insulin. So this is to control high blood sugar. You want to inject this medication slowly, as well as rotate sites. And you might experience minimal pain, redness, or a little bit of itchiness with administration, but you do need to report any signs of anaphylaxis or extreme low blood sugar. So now I will have washed my hands, put on gloves, and now I'm going to assess the injection site, which is going to be the abdomen. So I'm going to expose the abdomen. Here, so my injection site is going to be 2 inches away from the umbilicus. So it's going to be right around here, in the fatty part of the skin. So I'm going to clean my injection site for 20 seconds, inward to outward. And while that is drying, I am going to ensure I have the right client, medication, dose, route, time, and look for any expiration dates. At this time, I will now have my second nurse confirm that I have 35 units.
Yes.
And now I will remove the needle cap. Grab 2 inches of skin, inject my needle at a 90-degree angle, inject slowly, hold for 10 seconds. And remove at the same angle I went in, at a 90-degree angle. I'm going to recap my needle with 1 scoop method. Place into my sharps container. Wash my hands. Well, I will have cleaned up any minimal blood. Remove my gloves, wash my hands, assess the injection site for redness, swelling, or any abnormalities, and none of that is apparent. So I'm going to document. Okay, so now I will move on to my next medication, and that is just a tuberculin test. So this is our purified protein derivative. This one you will have to come back in 48 hours to determine if you have tested positive and been exposed to tuberculosis. You will also want to inject this medication slowly, and we are going to watch for a little bleb up here under the skin. You might have minimal bleeding at the site, but if you do experience any swelling, redness, or it is hard to breathe, you do need to report that. So I'm going to wash my hands and put on gloves. I'm going to assess the injection site, which is going to be the forearm. Going to inspect for any lumps, lesions, wounds, scars, inflammation, or in hair, and none of that is apparent. So I'm going to clean my injection site from inwards to outwards for 20 seconds. While that is drying, I'm going to perform my third medication check consisting of the right client, medication, dose, route, time, and make sure I'm within the expiration date. So now I'm going to remove my needle cap. I'm going to pull the skin taut, and since this is an intradermal medication, I'm going to have the bevel up, pull the skin taut, and insert at a 5 to 15 degree angle. Inject slowly. Remove. One scoop method. Dispose of my needle. Clean up minimal bleeding without pressure. We will have watched for the blood up here. I'm going to circle where I administered my medication. I will remove my gloves, wash my hands, assess the site for any redness or extreme swelling. None of that is apparent. So I'm going to document. Okay, so for your last medication, we have escitalopram. This is for your depression. Well, this is an antidepressant, so it's for your depression. To make sure that you're taking this medication correctly, since it is in a tablet form, we need to ensure that you're sitting up correctly, as well as taking this medication with water. So you might experience a little bit of nausea, drowsiness, or constipation, but if you do experience any anaphylaxis or seizures or even a fever, you do need to report that. So I'm going to wash my hands, put on gloves, get my medication, and make sure I have the right client, medication, dose, route, and time. I'm going to assess if my client is able to take this medication and swallow. My patient is able to, so here you go. And I will have stayed by the bedside to ensure that my client has fully taken their medication. So I will have thrown all my stuff in the garbage, remove my gloves, wash my hands, and document. Okay, so now I'm going to clean up just a little bit. So before I am complete with my administrations, I do want to evaluate the effectiveness of the medications. So for your diazepam, has your anxiety improved? My patient's anxiety has improved. For the ceftazidime, as well as the purified protein derivative, those ones you will have to come back in about 48 hours just to make sure that they are both working correctly, such as the antibiotic, and make sure that you didn't have a positive reaction to the tuberculosis test. And for your insulin, I will now recheck your insulin, and those numbers have gone down, so that means it was effective. And also for the escitalopram, that one we'll have you reschedule and come back in a week to ensure that your depression has minimized. So now I'm going to ensure my client is safe, putting up the bed rail, placing the call light, wash my hands, gather my equipment, and document.